All right, everyone, welcome back to Ortho Mastery Insights. I'm super excited to have a research conversation today with Dr. Jeff Williams. Dr. Jeff, welcome. It's great to connect.
Well, thank you so much for having me. It's kind of hard to connect with Australia, right? Is that where you're at?
Yeah, that's exactly where I'm at, and we are a long way away. There's no doubt about that.
Indeed. I've got a podcast called Chiropractic Forward, and I've done interviews with Dr. Anthony Nicholson. I don't know if you're familiar with him. And that was always a trick to set that up and do it perfectly so it would fit for everybody.
Yeah, look, the time zones can make it challenging, which is why when we pre-record this at a reasonable time for both of us, we can get this out and people can learn from you with this message at a time suitable for them. So I'm excited for this conversation. Before we go any further, I'm going to introduce you to those not familiar with the incredible work that you have done and continue to do. I'm going to talk about your book today, which I'll get to in a moment. But firstly, Dr. Jeff Williams received his doctorate degree in 1998 from Parker College of Chiropractic, and today operates Texas Panhandle's first fully integrated pain and wellness clinic. Dr. Williams has worked tirelessly separating himself from the normal chiropractor, and he has done that by achieving board certification, fellowship, and diplomat status in both neuromusculoskeletal medicine and forensics. It's a really fascinating position to hold, and that is because it's his mission to improve the overall quality of life of his patients while providing care with compassion, respect, and a loving spirit tending to the mind, body, and soul of each person that enters Creekstone Integrated Medical, where Dr. Jeff operates. But we are going to talk about this book, which I want to really highlight the remarkable truth about chiropractic, a unique journey into the research is more than a book. It is a resource. It is an opportunity for you. And you can see everyone here, I've dog-eared this. I've got, if I open this up, you'll see even through here, I've got notes written in there. If you can see that close enough, I've written all through this. I've highlighted points because when you want to share the chiropractic message, you want to have a conversation piece that makes that possible. And the research of chiropractic, we do not have enough of it. And for someone to have compiled an easily accessible research tome for you, for the chiropractor, grab a copy. It's on Amazon. I keep it. I open this every day to share the message with patients about the research we have, the changes we deliver, the impact that we have as a profession. So to have this conversation with Dr. Williams, grab your book, but listen in. This is going to be practice changing. Dr. Jeff, thank you so much. I appreciate it again.
Man, you're setting me up here. Hopefully I can live up to this. It sounded great, though.
Well, look, let's start with the first question. What prompted you to write a research book, or really a collation of research, and to make it accessible to who and to why?
Well, it's a bit of a long story, but I'll try to condense it if I can. So back in, I don't know, 2006, 2007 or so, I think I was on the forefront of trying to really establish myself as far as Google SEO, search engine optimization. You got to write blogs. So I'm creating content every week. And it was just scattered. It wasn't really very focused. And one week it might be the difference between white and wheat bread, which one's the best? And the next one, it might be something completely different. And I stumbled on one day some research that had to do with chiropractic, manual therapy, spinal manipulative therapy, whatever it was. And it really, really just grabbed my attention almost immediately. And to the point where kind of everything else went away. And I went, this is kind of what I've been looking for. Because in our profession, there are extremes on both ends, vitalists and evidence-based, towards the middle ground. There's just, I don't know, we get out of school and we go through practice and we just do our things, but we see the results, but that's anecdotal. There's no organized research, or at least to my knowledge, there wasn't. And when I came across it, that validated everything that I did and I knew and I'd seen and experienced over several years, well, then it really got my attention. And so I thought, well, I'll start blogging on this sort of stuff because I'm super interested in it. And not only will it educate me, but it'll also educate the public, my population. And so I kind of really started going down that path. And the next thing you know, and I really thought, I'm going to run through all the research there is in about 6 months. I mean, that's how dumb I was. I didn't realize this whole big world of research, chiropractic research, was out there. So the more I got to looking, the more I found, and the more of that I found, the more I found over here, and it just kept on snowballing and snowballing to the point where I was just creating content all the time. And then finally, my webmaster, he said, this is really above the average population. They don't care about some of these words, and so I thought, well, you know what? I'll dumb my blogs down a little bit. Hopefully that doesn't come off as derogatory, but I'll put it more in layman's terms. But for my own purposes, maybe I'll just start a podcast and I'll write the same sort of content, but I'll use it for my Chiropractic Forward podcast. And so then I started doing that, and we cover 2, 3, sometimes 4 papers every single week on the podcast. And then I got to thinking, well, I have all of this content and all of this material. What if that were categorized in a way that you could just go straight to, like, neck problems? You want research on neck pain? Just flip to the neck pain section. You want research on SI dysfunction? Just flip straight to that section and go. And stroke issues, let's go to the stroke section. And so that was kind of how the idea came about. And I just started compiling all of the stuff so it was about a 7 or 8 year in the works project.
Yeah, well, firstly, I want to acknowledge you for not just the time, the effort, energy you put into, but the accessibility of that information, as you said, and the usefulness of it as well. And again, as I said, I open it up every day, and when I can open up and say, when someone says, is chiropractic really going to help me? And I can open up and say, you know what, if we begin care and you maintain this care, research shows quite clearly that you have the possibility of experiencing 60% less days in hospital, 62% less outpatient surgical cases, 85% less pharmaceutical costs, and a sense of personal health and satisfaction that is unmeasured against other professions. And I can go through, and if they come in with the lower back issue or the neck or whiplash issues, I can cite them the research that evidences the effectiveness, the efficacy, and the value of chiropractic for them, dismissing their doubts, their uncertainty, their fear, and exciting them with possibility and hope. And it's all there in black and white in a book. And that is the remarkable truth about chiropractic, that we do have a profound and powerful influence on their health, on their life, the trajectory of their life. And so that's why I wanted to have this conversation with you, because I wanted to personally give my thanks and appreciation, because using this in practice, I find invaluable, but more importantly, for our profession to start getting the recognition for the research is so imperative. And you've done the work. Everybody needs to go and purchase that book so that you get that deserving position of recognition as an author for that. So I want to vocally thank you for the profession, but also I want to ask a few more questions about how are you using this in practice, and how are you finding it being received at that clinical interface?
Well, I want to back up and just say that it would be easy for a detractor to say, maybe try to discount this research, this information. But for the most part, these research papers are randomized controlled trials. They're systematic reviews and meta-analysis, that the very tip top of the research pyramid. These aren't just case studies or pilot studies. These are, for the most part, cream of the crop. And I'm not a researcher. I'm not a PhD. I'm not going to pretend to be. I'm a purveyor of research. And my whole point with this book was just to dumb it down for me. And then if I can get it to a point where I can clearly understand it and appreciate it, then I can tell others about it. And so that was the whole point of the book. Was it's not written for other researchers. It's written for you. It's written for me. It's written for those of us who go and give public talks, and they need some research to back up what they're talking about. They can find it really quickly this way. But I use it. I use it all the time. So I'm like I said, I'm a content creator, and so I will for my own personal clinic, for the podcast or whatever, I'm always citing this research. One of the biggest ones in here is 2016, Amarillo. I'm from Amarillo, Texas, sorry. The American College of Physicians, which to my understanding is the world's largest medical organization. They updated their recommendations for chronic and acute low back pain to include their first line therapies before you do anything else would be spinal manipulative therapy, exercise, massage, acupuncture, yoga, tai chi, cognitive behavioral therapy, low-level laser, and there's a couple of more in there that I'm just not familiar with. But so I can't tell you how many times I've recited that very thing over and over and over in all of my content, in my talks with my patients, and this book, or the information in that book that I've compiled and am just aware of naturally through the process, I use that information every single day, all through the day, not once or twice. I mean, I use it all day long.
Yeah, absolutely. And that point again, when you have these situations where a practitioner comes and says, oh, my doctor's probably suggesting, my general practitioner or medical doctor says I shouldn't see a chiropractor. So hang on, the research is clear. The people educating the doctors, the people who are training your GP, who may not have had this training because he may not be going to the educational events or symposiums where the cutting edge practitioners are, they're telling them that they should be coming to somebody who delivers spinal manipulative therapy, which from a chiropractor's perspective, we may call it adjustment or spinal manipulative therapy, whichever term you use. Medicine is saying this should be your first port of call and that you should be exercising in addition to that. And this is really the chiropractic lifestyle. So if your doctor's not recommending that, perhaps they haven't been reading the literature.
Yeah, well, and I tell them, I don't want to throw anybody under the bus, and ignorant can mean different things to different people. To me, and the way I'm using it is that if your doctor is telling you that, then they are ignorant of the latest research and recommendations by the medical field, by their people, not my people. And that's the best part about a lot of this research. The majority of this research is not through chiropractors. This is through universities, governments, insurance companies, physical therapists, MDs, people that traditionally hate us. And so if you've got people who traditionally hate you going, they're pretty good at what, when it's done correctly, responsibly, appropriately, ethically, they get really good results.
Yeah, it's brilliant. I mean, I go back to, when I read your book, it reminded me of an expanded, more cohesive, better organized version of the Manga report. And Pran Manga was an economist who gave a great, I think it was 96, was it 1996, who concluded that the most effective method of managing lower back pain and musculoskeletal conditions was chiropractic. He didn't have a chiropractic or anti-chiropractic bias. He was simply an economist looking for ways to most cost-effectively manage money. And so we have this research, this supportive evidence and information. Again, you've collated beautifully. It offers us a great way of supporting the claims that we make, backing up the recommendations that we provide, and giving that confidence to the patient in the practice. So I love that you're using it every day. Sorry, you look like you wanted to say something else there, Dr. Jeff.
No, you're doing great.
Awesome.
Yeah.
So in addition to using it in the practice, when you then, again, you can see here, I'm in my room, I have it here by my desk, I use it as you do every day. What are you finding from the colleagues that you speak to, from when you're on your podcast or presenting on stage? How are the chiropractors who are now finding out about your book, about the way that you educate using research and practice? What type of a response are you getting from them?
Well, I'll be honest with you. I'm not sure how many people have their hands on it. I mean, it's been out. Oh, next month will be about a year it's been out. And, everything starts slow. And then through things like this, more and more people find out about it. The ones who I have heard back from are like you. They love it. It's a handy resource. And I even have patients buy it in my office. So we've got a little display. It's kind of, it's good marketing when your chiropractor wrote a book, didn't have a ghostwriter do it, but, he actually did it himself. We have lots of patients buy it, and they all love it too. So it's hard to say. I'm not sure, but I love hearing your feedback. It's very encouraging. I've been thinking about doing another edition. I just need because research just keeps on rolling. It didn't end a year ago, and get some of the research papers that maybe just barely made it into this book and kick those out and get some of the new really solid research in there and just kind of keep rolling.
Yeah, well, I encourage it because, again, the body of literature is growing. The research within that literature is expanding the scope of chiropractic, the value and impact in people's lives. So please, I know and I'm saying please on behalf of me, because I know you're the one going to go and do the work. And again, for those that have sat on the fence and who've got the book and haven't told Dr. Jeff, this has been great. Send those messages, because it does really provide that impetus to go do that additional work. So I know that it's valuable, and I appreciate that, which is why I wanted to get you on this, to make sure people did know. You mentioned there the role that it has in terms of your patients appreciating it, and you said before writing a book has a real value. So for chiropractors who are wanting to position themselves with greater authority or increase their awareness within the public, talk about what that meant, how the writing the book has enhanced your position, and even doing the podcast, Chiropractic Forward. What does this mean for you on a professional level? Your status, your authority, or your positioning? How has this been valuable?
Well, again, it's hard to measure, because chiropractors who are successful are also probably pretty good at marketing, and so they have lots of lines out in the water, and so it's hard to know exactly where everything comes from. But I can say that because of the book, or being an author, sets up a platform of respectability, authority on some level, and this guy, especially if you were mentioning the forensics fellowship. Well, that's medical, legal, expert witness work. Well, when the attorney can look at the chiropractor and go, he wrote the book on this, that comes with some sort of status. And I'm also trying to hire an associate chiropractor so that I can start doing more medical legal work and do more speaking opportunities and more things outside of the office. And I think the book is a great launching platform for that.
That's great. Appreciate that. It's wonderful feedback. Really, as we come to the end of this conversation, the last question I really have, which I'd love your feedback and thoughts on. Chiropractic research. Well, there's a lot in here. There is a lot more to come. What are your thoughts on the profession's need for research, its need for more research, and what individual chiropractors can do, whether it's doing research themselves or providing fundraising to research organizations? So I'd love your thoughts, your insight, your take into the research body of the chiropractic profession.
Man, there's a lot you could unpack right there. There's a big organization called CARL that we could all contribute to. I contribute to it, and that's all based around chiropractic research. But it's an acronym, but I can't remember what it stands for. But it's called CARL. Let's see, the FTCA, if you're on Facebook, the Forward Thinking Chiropractic Alliance, they're doing a lot of great stuff as far as evidence-driven, evidence-based type of practice, patient-centered, ethical, that type of deal. And I just, for me, that's the future of chiropractic. If we're going to ever integrate into a true team member, broad management, member of the healthcare profession, then we got to start speaking their language. And their language is research. It's not a lot of crazy stuff that's not backed by research. Now, you might have seen a couple of things work in your clinic, and that's okay, because we've all seen miracles and it's cool. But until it is backed by research, You can't market it. You can't go and go, look what I did. I cured cancer. You can't do that stuff. You know, you got to speak the language and you got to play the game and you got to play it by the rules. And the rule book is research. So if you have noticed something that was amazing, do some research, prove it, and then prove it again. And then let's show everybody, let's tell everybody about it. I'll be the first one to tell you, even if I think it's crazy. If I see that it's the proof and the research, I'll scream it from the building tops. But getting back to the point is that their language, their rule book is research. And the more we are aware of our own, because there is a mountain of it, most of us just don't know about it. So there's a mountain of it, and the more we're aware of it, the more we can speak of it and relate that information, the better off we're going to be.
Yeah, absolutely. And in my mind, when I hear you say that, I always think that chiropractors have a responsibility, if not an obligation, to be involved in research, either doing research, and that doesn't mean being in a science lab with multi-million dollars of projects. You could be doing case studies. It's not the highest level of research, but it is still valuable. And if you're not doing case studies, or if you're not involved in research, at least be involved in funding organizations that do the research to support the profession, to evidence the effectiveness of chiropractic. And that's why I love this book, Dr. Jeff. I appreciate you. And everyone, grab a copy, use it in your practice. It will change your education. It will give you conviction. It provides confidence and certainty. And every chiropractor educating their patients from that foundation is going to change their lives. And for that, Dr. Jeff, I'm so grateful, so appreciated. Thank you, my friend. It's been great.
Thank you, sir. I appreciate you. Thanks for having me.